The top 5 deadliest diseases haven't changed much in the past decade, but great strides have been made to lower the number of deaths from some of the top 10 deadliest diseases. Top of the list is coronary artery disease. Stroke takes position 2, chronic obstructive pulmonary disease, lower respiratory infections, trachea, bronchus and lung cancers, HIV and AIDS, diarrheal diseases, diabetes mellitus, preterm birth complications, tuberculosis follow each other in that order. We start with the diarrheal diseases ranked 7th, specifically cholera, which has in the past 3 months ravaged Nairobi to the extent that more than 300 people are in hospital and at least 3 are reported to have died of it, a disease commonly a sign of poor hygiene. In total, the disease, which causes acute watery diarrhea and can kill within hours if not treated, registered 1,216 suspected cases and 14 deaths between the start of the year and July 17th.
What we are seeing is an outbreak which is widely spread. So far, 381 patients have been seen, not recently, since April, towards the end of April. At the moment, Kenyatta National Hospital has 101 patients.
For it to have even attacked Cabinet Secretary means something is seriously amiss that needed the intervention of the Cabinet Secretary for Health, Cleopa Mailu.
We have so far closed 2 hotels, Jacaranda and Valencia, and we shall continue to do so if there is evidence that there is risk to the public.
The main reason why people who are not poor sometimes are affected is because of the water that they are using. In Nairobi, in the recent past, we have had a scarcity of water, and because of that, big hotels have been relying on water vendors who are not certified, and so who supply, water that is not safe, for use.
It is caused by Vibrio cholerae, a strain of bacteria that doubles in numbers every 13 minutes, attacking the stomach and intestines, killing a healthy adult in hours.
If one is going to eat food that has already been contaminated with feces from a person who was infected, of course we are likely to have the spread of cholera. And because you find that most of the time cholera is as a result of poor sanitation.
It is not uncommon for people to start having diarrhea in the morning and die from dehydration in the evening. As a result, a prompt diagnosis is crucial. Fortunately, the appearance of the diarrhea can be a great diagnostic tool. According to Professor Keraka Margaret, the incubation period of cholera is about 12 hours to 4.5 days.
This is a disease which has high risks of death among those who are affected. Less than 5% may be treated, but at least 50% among those who are affected may end up, being affected if they are not going to be to receive treatment on time.
Only about 1 in 10 people affected develop symptoms, but those that do must get treatment quickly and can experience excessive watery diarrhea, vomiting and abdominal cramping, as Professor Keraka tells us.
The signs of wrinkles, on the hands, on the legs, and dry mouth, and so at the end of the day, due to dehydration, this person again is likely to suffer high blood pressure. Of course, now which may also be a risk factor in terms of the survival status of this particular person.
Cholera is an easily treatable disease.
The waters that we are using, is this water safe? Is it treated? So the water needs to be treated. It needs, to be boiled, purified for us, to use it. We need to have tests of the water to ensure that, they are not contaminated waters.
Prompt administration of oral rehydration salts to replace lost fluids nearly always results in cure. In especially severe cases, intravenous administration of fluids may be required to save the patient's life.
If they have been exposed to high levels of dehydration, a lot of diarrhea, wastage, experiences, then that is the point where probably we may need, to give them supplementation. Dehydration, that should be done continuously.
The disease, which has mostly been eradicated in developed countries due to proper sanitation, can be treated without diagnosis being made. Each year, cholera affects 1.3 million to 4 million people and causes about 20,000 to 140,000 deaths worldwide. The worst epidemic being in 2010 in Haiti, after the earthquake claiming the lives of at least 7,000 Haitians and sickening a few 100,000 more while spreading to the neighboring countries of the Dominican Republic and Cuba. My name is Ouma Onyango, reporting for KUTV, Nairobi.